transforming Philippine health systems towards universal health care through research partnerships. To articulate the goal of the NIH to undertake relevant and inclusive health research to reach our goal of health for all. We recognize that we can only do this if we do this together. We believe that UP Manila has a lot to offer. Its faculty, alumni, and adjunct faculty here and abroad who can actually make a difference in making our lives in the Philippines much better. We believe that collaborations equip decision makers with an accurate and adequate evidence base to formulate more equity-oriented policies, programs, practices towards the progressive realization of the UPHC. We'd like to believe that we are one of the main collaborators of the Department of Health.
Today, I am very glad to see a very important element of the 300 Spartan research that stood behind today when they were asked to stand. And I felt immediately that I am where I wanted to be.
Thank you everyone for listening, and I look forward to seeing the fruits of our foresighted initiative of materializing our shared vision of the Philippines as a prosperous archipelagic maritime nation. Maraming salamat po at magandang ulit ang lahat. I hope this might be able to calibrate your horizon.
Health technology assessment helps achieve the goals of UNC by providing evidence for policy and possible adoption of technology.
Failure to address all these system needs will lead to inadvertent aggravation of inequities in health.
most current innovations, but examine them in these 7 domains of quality, namely safety, being free from harm, effectiveness or providing services based on scientific knowledge, timeliness, reducing waits and harmful delays in care, efficiency, which is avoiding waste of equipment, supplies, and other resources, equity, and I think that's something that ever since the start of this morning has been really emphasized by our speakers, and patient-centeredness, or providing care respectful and responsive to the needs and values of our patients.
Again, I emphasize that point. Primary care will deliver the majority of care to our patients and populations. And because of that, we need primary care in order to achieve universal health coverage.
It is imperative, therefore, that we expand our knowledge through research so that we can tailor services to their needs on a background of limited resource setting.
So we hope that in the future, the healthcare system would fully address this lack of access to eye care, as well as the financial resources when a patient would have eye diseases. Thank you so much.
In using the CGA, we are able to detect other medical problems such as urinary incontinence, something that they rarely discuss with other people because they're too shy or ashamed not to talk about it. So we really have to assess them using a good form, it's called the CGA.
One is institute newborn hearing screening programs and development of educational programs for the public and health practitioners.
Financing primary health care actually makes you healthier.
It is not enough that we are able to screen patients for disorders which may have dire consequences for their health. What is more important is that we appropriately manage them for their diagnosed conditions and that they and their family would have a good quality of life.
So there really is value in using your diagnostics properly because it can save money and it also can save lives.
Hopefully, fund transfer from other government agencies and within the UP system would become easier.
what we are trying to do is to make sure that we are able to establish integrated local health systems, not just connecting the primary care facilities, but connecting them vertically as well as horizontally for us to be able to cater and provide services that's buttressed by digital health solutions at the forefront.
So what's the message of the mathematical model? Okay, it says CQ is needed only to buy time in order to improve the HSC. Improving the health system capacity is the key to effective control. So, and this is perhaps the biggest contribution of the model in decision making.
In the future, I think we should remember that it still needs a lot of work, but we are looking forward for more fruitful collaboration with the National Guideline Program through the DOH DPCB, preparing for UHC implementation.
We thank the organizers because we end now with the hope for the future, the expansion and replication of the UP Manila NIH National Clinical Trials and Translation Center model to other regions and formation of more regional clinical trial centers. Thank you very much.
By sharing a few of initiatives in relation with the discussions today, I'd like to highlight that we share the same vision to generate solutions that will serve the needs of every Filipino.
The aim of mainstreaming the use of Philippine herbal medicine into the healthcare system can be achieved by creating the Philippine Herbal Medicine Industry Development Plan.
A lot more things to work on together, but thank you very much to our NIH teachers, mentors, colleagues, collaborators. We do hope we will have a bigger, better relationship with the NIH as we go along, and we commit to working with you better in more fruitful ways. So maraming salamat po.
All right. Good afternoon once again. I think we are ready to start the program. Thank you. Okay. A pleasant good afternoon to everyone. I'm Dr. Rohani Navarro. I'm a research faculty here at the National Institutes of Health. So to formally start our program, I'd like to request everyone to please rise for the invocation to be followed by the singing of the Philippine National Anthem by the UP Med Choir.
One thing I ask to
po sa ating lahat and happy 26th NIH Anniversary Conference. Yes. Can we just spend like some few seconds lang to greet our fellow colleague? Happy 26th anniversary. Ayan, happy 26th anniversary. Yes, we are celebrating this momentous event here live in this beautiful building of Henry C. at the UP College of Medicine. And wait, there's more. We are also joined by more than 200 participants virtually via Zoom, via Facebook Live, and via YouTube. So we are streaming live on these platforms. And for more 26 years, so for more than 2 decades, the NIH has been in the forefront of scientific research to create new therapies, procedures, medical procedures, diagnostics, and even more outputs that serves as vital guideposts in shaping national programs. 26 years is truly a significant milestone, and we're here today, gathered here this afternoon to celebrate this achievement. We have a very, very special event this afternoon, and there's no better person to welcome everybody other than the executive director herself. To give her welcoming remarks, I'd like to call Dr. Eva Maria Cochonco de la Paz.
Thank you, Rohani. Magandang hapon po sa inyong lahat. I warmly welcome all of you to this one of a kind event of the National Institutes of Health as we celebrate our 26th anniversary year. This is the first we felt the whole year as our directors and research faculty and staff led by Dr. And the staff of NIH led by Dr. Emmanuel Baja as chair of the organizing committee. You won't miss him. He is in coral pants at the back. They have organized a three-part series on justice, equity, diversity, and inclusion in population health research. We're so honored that we have with us today our President Angelo Jimenez is on his way. He's coming from another event in UP Diliman. Of course, we have our Department of Science and Technology, Philippine Council for Health Research and Development Executive Director, Dr. Jimmy Montoya, and our distinguished speakers, National Scientist and former Chancellor of UP Manila, Dr. Ernesto Domingo, National Scientist and former Chancellor of UP Manila, Dr. Carmencita Padilla, our moderator, the Director, Program Management of WHO Western Pacific Region, Dr. Susie Pineda Mercado. And of course, we are so happy that UP Manila Vice Chancellor for Research, Dr. Leslie Dalmasio is with us, as well as the Director of the Philippine General Hospital, Dr. Gap Legaspi. We are really pleased to have among us also, I hope he will be arriving soon. We have Attorney J.B. Bailon, our first private donor to the new NIH building. I'd like to say formally, thank him formally for believing in us, that we deserve a building. The NIH was established by the Philippine government on February 9, 1998 as a National Health Research Center through the Health Research and Development Act, or Republic Act 8503. The NIH, as Rohani mentioned, is an institutional home of a network of researchers and research institutions. And since its creation, it has grown from 4 institutes to now 16 institutes and centers that develop outputs that serve as vital guideposts in shaping national health programs and policies. The NIH is a major player in the implementation of 4 laws in the country. RA 9288, or the Newborn Screening Act of 2004, RA 9709, or the Universal Newborn Hearing Screening Act of 2009, RA 10747, or the Rare Disease Act of 2016, and most recently, RA 11358, or the National Vision Screening Act of 2019. 2 of those were authored by national scientist Dr. Carmencita Padilla, and one was authored by our Dean Charlotte Chong, and who is also a research faculty or research professor of the NIH, and the Vision Screening Act from VP was authored by VP Leo Cobillan from the Philippine Eye Research Institute. The NIH also has 17 active study groups, which are multidisciplinary, multi-institutional collaborative groups, which seek to address other neglected health needs. NIH connects UP to health institutions in the country and to the global health research community. Director Gap sent me early this morning at 12 midnight an insightful yet disturbing news about recent reports in the US that the number of physician scientists, these are doctors who both practice medicine and perform scientific research, has dropped from 4.7% 3 decades ago to 1.5% now. This is a problem because physician scientists are uniquely equipped to make scientific discoveries that have been proven to transform the practice of medicine. The many reasons identified include lack of and very competitive funding, lack of mentors, less income for the physician scientists, making it a less attractive career path. At the NIH, I'm happy to report to all of you that although, especially our guests and administrators, that although many of us are physician scientists, majority of the research faculty are have their teaching unit at the College of Medicine. We also have with us our PhDs who are health economists, social scientists, pharmacists, veterinarians, epidemiologists, and data scientists. I told Director Gap that we still have the opportunity to get our act together to see an upward increase of physician scientists as well as other health scientists in our country. We are starting from the bottom, so there's no way but up. The deputy directors who are all here, the directors of the NIH and institutes and centers, and the research faculty. These are men and women of science, some young, some not so young, who conduct various health research to address gaps in knowledge and promote health innovations in the country. But we also have the NIH staff who are also present here who deserve to be recognized for their dedicated service to the NIH to ensure that research operations and processes go on as smoothly as possible. So I thank them from the bottom of my heart. And of course, the NIH is grateful to the UP administration for the invaluable support and to our research and development partners for better health, the DOST, the Department of Health, especially the Philippine Council for Health Research and Development, CHED, and WHO. Who were both previous chancellors. Both are visionaries. Ay, three. Sino pa po? Ayun nga. Sorry, wrong. Nakalimutan ko si UP Manila is the only constituent university of the University of the Philippines with three national scientists and who were all also previous chancellors of UP Manila. Sorry, Dr. Perla Santos Ocampo. So all of them are visionaries with stature and substance. Our dynamic host is no stranger to all of us. She is the beautiful face of TVUP's Stop COVID Death webinars, who has made her mark in local, national, and international public health and now holds a very important, influential position at the WHO. I hope you are all as excited as I am to listen, to learn, and be inspired. Maraming salamat sa inyong pagdalo sa kaganapang ito at magandang hapon po muli.
Thank you, Dr. Eva. And sabi nga ni Dr. Eva, there's no way but up. And as a young scientist, I think, and all of the scientists here, what we're doing at NIH is really more than just an academic exercise and publications, but we're really here to help people. So there's no way but up. Thank you, Dr. Eva. So now I'd like to call to give the message from the Chancellor, UP Manila Chancellor, Chancellor Michael T. I would like to call Dr. Leslie Dalmasio, the Vice Chancellor of the University of the Vice Chancellor for Research of UP Manila to deliver the message. Ma'am.
National Scientist Dr. Carmencita D. Padilla, National Scientist Dr. Ernesto O. Domingo, NIH Executive Director Dr. Eva Maria Cotionco de la Paz, sana si Ma'am. Ayun. And PGH Director Dr. Gerardo Legaspi, DOST-PCHRD Executive Director Dr. Jaime Montoya, WHO Program Management Director of WIPRO, Dr. Susan P. Mercado, and the DOA and the NIH directors, officials of UP Manila, and other esteemed guests, ladies and gentlemen, good afternoon. So on behalf of Chancellor Michael L.T., I will be delivering his message on this great occasion. So I extend my warmest greetings to the National Institutes of Health, the health research and development institution of the Philippines, in their 26th anniversary this week. It has been some time since the NIH was institutionalized through Republic Act 8503, or the Health and Research Development Act, signed by then President Fidel V. Ramos. Although UP Manila was already leading in the aforementioned field, it was through the institutionalization of the NIH that this leadership in research and development was crystallized and given a body of its own. It was through RA 8503 that UP Manila received the right assistance in expanding the type, quality, and quantity of its mission-oriented research in the spectrum of health. The NIH reflects the best of what Filipino knowledge has to offer, melding into itself the traditional ways of our heritage, the most advanced technologies of today's world, and the innovations which show us what the future holds for healthcare. From the Institute of Herbal Medicine to the National Training Center for Biosafety and Biosecurity, its 17 institutes are all dedicated to the pursuit of the well-being of the entire encompassment of the human body, from its innermost fibers up to the span of its existence, right to the policies that ensure the continuity and preservation of public health safety. It characterizes that we have, are, and are still exploring other areas of health that we may still need to study about and develop policies and technologies for. More than anything, it continues to come up with plans and ideas to convince government officials and policymakers to make timely changes and improvements to our healthcare and public system and our way of life. The NIH is heavily involved in facilitating research, capacity building initiatives, crafting of policies, and publication and application of research findings. Through it, all scientific research relative to health is properly processed and implemented and continuously studied. And now, in its 26th year, it aims to do more. This year's theme, JEDI, or Justice, Equity, Diversity, and Inclusion in Population Health Research, ensuring better health research practices, interventions, policies, and outcomes for all, reflects the NIH goal for the total and holistic improvement of the population. I believe that the theme was born out of the necessity of the country and the world in particular for the healthcare professionals to come up with preemptive measures and plans as we have just survived a pandemic. To mold population research in the principles of JEDI would ensure that the side effects of global or national health emergencies would be contained and that the welfare of those who are less fortunate are considered. The disruptions brought about by the previous pandemic were especially severe among those in developing countries, and we are trying to prevent such impacts should there be another such emergency. So this celebration is pivotal in preventing another global or national health emergency. Interventions, preemptive responses, and proactive policy shall be discussed, and I am sure that with the caliber of our two highly esteemed national scientists, Dr. Domingo and Dr. Padilla, there will be great results. When I took office more than 3 months ago, I promised to endeavor for research that aids in decision-making for public health and clinical services, together with local and international experts who either share or complement our expertise, transmuting our academic expertise into social good. Thus, please be assured that UP Manila shall continue to fully support the NIH in its vision to remain the recognized authority in health research and development and the key source of critical health information for national development, all striving to provide health for all. Mabuhay ang National Institutes of Health, mabuhay ang UP Manila.
Thank you, Vice Chancellor for Research, Dr. Dalmasio. And I resonate to that, the kind of support that the UP administration is giving to scientists like me as an early career scientist, because one is to have like a passion for research, but to get that support from the administration is another thing. So thank you to Chancellor Michael T. and Dr. Dalmasio. And speaking of support, we're very honored today because we'll be hearing a message from one of our strong supporters and funding partners from the Department of Science and Technology, Secretary Renato Solidum.
Ladies and gentlemen, esteemed guests and dear colleagues, a pleasant morning. I am honored and excited to address the community of health researchers today at the 26th anniversary conference of the University of the Philippines National Institutes of Health. As we gather here today with the theme Justice, Equity, Diversity and Inclusion in Population Health Research, ensuring better health research practices, interventions, policies, and outcomes for all, we share a mutual goal of initiating discussions and collaborations grounded on the principles of justice, equity, diversity, and inclusion, which are not just abstract concepts but values that resonate deeply with each of us, guiding our efforts towards a healthier and more equitable society. Throughout this year-long celebration, we have the opportunity to delve into the complexities of population health research, examining how it intersects with the lives of individuals from all walks of life. From the most vulnerable among us to those in positions of privilege, our discussions will shed light on the disparities that exist and explore concrete actions we can take to address them. But beyond the academic discourse, this anniversary is also a moment to celebrate the incredible work of our scientific community. The National Scientist on National Scientist Dialogue promises to be a highlight of this program, offering a glimpse into the passion and dedication that drive our researchers forward. As we come together in the shared space of learning and discovery, I encourage every one of you to lend your voices to the conversation. Your perspectives, insights, and experiences are invaluable as we strive to create a future where better health outcomes are within reach for all. Finally, let us participate in the discussions with open hearts and minds, knowing that our collective efforts today will shape a brighter and healthier tomorrow for generations to come. Maraming salamat at mabuhay ang UP NIH.
Thank you very much, Secretary Solidum. And joining us today this afternoon, we have the Executive Director of the Philippine Council for Health Research and Development, also our very strong partner, Executive Director Dr. Jaime Montoya. Sir.
Thank you very much, Dr. Rohan. National Scientist Ernesto Domingo, National Scientist Carmencita Padilla, Vice Chancellor for Research, Dr. Leslie Dalmasio, PGH Director, Dr. Gap Legaspi, the officials of UP Manila, the directors and members of the institutes under the National Institutes of Health, of course, the head of the National Institutes of Health, Dr. Eva Cuchonco de la Paz, who is frequently have communications, to Dr. Susan Pineda Mercado, the WHO person. We're so happy that you are in Pro and hope that we can work together. To fellow colleagues, workers in government, ladies and gentlemen, good afternoon. It is indeed a pleasure to share this important occasion with all of you. As we gather here today to celebrate the anniversary of the University of the Philippines National Institutes of Health, we at the DOST Philippine Council for Health Research and Development are filled with a profound sense of pride and gratitude. This day marks not only a milestone, but also an opportunity to reflect on our collective achievements and reaffirm our commitment to advancing health research in the Philippines for the Filipino. This year, as we move forward along with the theme Justice, Equity, Diversity, and Inclusion in Population Health Research, ensuring better health research practices, interventions, policies, and outcomes for all, we are reminded of the values that guide our work and shape our vision for the future. Today, I would like to highlight the significance of these four words. First, justice. As health researchers and experts, it is our responsibility to advocate for social justice and champion policies that promote equity for all. Next, equity too lies at the heart of our mission. By prioritizing equity in our health research efforts, we can strive to create a more just and inclusive healthcare system that leaves no one behind. Third, diversity is also part of our pursuit in advancing health research by fostering a culture of inclusion and diversity in collaborations. We drive innovation that will propel us forward into our shared goals. Lastly, inclusion is the cornerstone of our initiatives to ensure that everyone has a seat at the table. By centering the needs and perspectives of diverse communities in each of our initiatives, we develop more effective and responsive interventions that address the unique challenges of every Filipino. We at the DOST Philippine Council for Health Research and Development recognize the transformative efforts and the work that the UPNIH has been doing, which benefited the lives of our fellow Filipino folks for the past 26 years. Lagundi, Biotech M, and so many other discoveries and innovations are just a few of the PCHRD-supported technologies and initiatives that we have assisted, which serves a testament to the unwavering support of the Council to our Pinoy researchers. We are very encouraged by the fact that the TAC Pinoy law has just recently been passed. Because of this law, we look forward to a more active research community with the whole of government giving priority to Filipino-owned and developed technologies. We look forward to working with you in the next few years to come, with a common mission of sharing our hearts through health research. Heart is actually our symbol in the council because heart stands for health research and technology. We'd like to share our hearts through health research as we strive to make the lives of our fellow Filipinos better. I extend my deepest appreciation to everyone at the UPNIH, and we're grateful to your dedication and significant contributions to championing health research. You are and will always be a vital partner in our efforts to pursue advances in health research, bringing the best out of every Filipino researcher for the benefit of the Filipino and the world. As we look into the future, I hope that we remain steadfast in our collective efforts to a healthier, safer, and better Philippines for generations to come. We commit our full support to the UPNIH and hope that you will still produce more than what you have produced before. So maraming salamat po sa inyong lahat. Mabuhay ang UPNIH. Magandang hapon po muli sa inyong lahat.
Thank you, Dr. Montoya. And dahil dyan, reminder lang, dahil call for proposals na, deadline, March 15, produce more daw, sabi ni Dr. Montoya. Again, March 15 po, council proposal. March 1 to 15. Pwede na sa Friday. Yes, okay. Thank you, sir. Thank you. All right. Okay, and now we'll also hear a message from the director of the Philippine General Hospital, Dr. Gerardo Legaspi. Sir?
Thank you very much. Um, I didn't know I was coming up, so I'm not dressed. But thank you very much for having PGH here. Coming from the trenches of the Philippine General Hospital, I'd like to congratulate the National Institutes of Health on their 26th anniversary. And I think coming from a clinician like me who was deep into neurosurgical practice before I entered public health in PGH, research was a far-fetched idea from a basic clinician like me. But I guess as we meet more scientists, physicians, more and more we realize and value the role of our colleagues in that field. And I think my realization and the revelations that I've had has brought us to a very strong research-oriented program in the hospital in coordination, of course, with the executive director of the NIH and UP Manila that has allowed us to increase our research output from a dismal 300 maybe in 8 years ago and publishing 8% of that 300 to around 620 now and publishing 80 of those in that span of 7 years. And the output is very inspirational to me, and it just proves the fact that if you support people who do what they do best, I think the outcome really is what it should be in a setting like the Philippine General Hospital and the UP Manila. We are in a world that's already different. Now, I realized this when I sent a message to my chairs in the Directors Advisory Board about a poster I saw that we cannot raise our children like we were raised because the world where we were raised in does not exist anymore. So we were trained in another world 30 years ago, and I think it's research that will allow us to bring everyone else to the current world that we all live in now. And we're all participants in that. PGH and its members support that very well. And I think the putting our money where our mouth is or was has proven that if you really support it, we'll go places. Sorry, I have to mention this because I saw the former chancellor here. We don't have the dean, but the executive director is here. I was often asked, what is the relationship of those leaders in UP Manila with the PJ's director? Oh, well, the chancellor is our mother. The dean is my wife, and the NIH director is my mistress. So I just realized that because we promised 100 million from the income generated of PGH to the College of Medicine for its simulation lab. And I just realized we promised 200 million to the NIH PGH Animal Laboratory, proving the fact that you actually give more to your mistress than to your wife. No, kidding aside, I think it's only time that we give it attention because COVID has made us realize that that the researchers are very important in making us realize the mistakes that we have committed and the mistakes that we should not commit. The partnership we had during COVID was really, I think it was holy to say the least. That in those trying times, the true work that needed to be done by researchers and clinicians on the floor, on the ground, was really evident. So I'd like to leave you with the promise that from the clinical standpoint, we research will always have our support. Thank you very much and good afternoon to all of you.
Thank you, Director Gap. At talagang nag-notes po ako dun sa 200 million for the Animal Lab dahil ako po yung Animal Facility Manager ng NIH Animal Lab. So thank you. Thank you in advance, Dr. Legaspi, for the support. And now we have another message. So it is my honor to introduce also the 22nd President of the University of the Philippines System, President Angelo Jimenez, for his message.
Thank you very much. Maayong hapon sa atong tanan. I have always supported UP Manila. I have always supported, in particular, your public health programs, including the College of Medicine. And I have always supported the Philippine General Hospital because I know that the life you saved could possibly include my own. Thank you very much for this invitation. I'm a lawyer and I have studied many things. But the one thing that misses me is how to make doctors laugh. I just don't know your funny bone. But I will try to make you cry. No, thank you very much. Um, I would like to thank thank you all for inviting me. Chancellor Mike, see, he's not here. Chancellor Menchit Padilla, three-time Chancellor Menchit Padilla. My Dr. Ernesto Domingo. Gap, Gap, you have always asked me for many of those funds. And when it comes to PGH and Manila, the reprogramming almost runs in the hundreds of millions. But I do not remember a time when I failed to deliver. Since I was a regent, and I am now the longest running regent of the university. I started as regent in 1992 when I was then chairman of the UP Diliman Student Council and student regent as well. So I spent so long in that office, particularly during the last 7 years where I sat at the Committee on Finance na nakakasilip-silip ako ng mga kung saan-saan, mga kalikot funds for some very important projects. And most of it were for UP Manila. I just came from my third program today. I have struggled to work in the office, but this is my third event for today. But I really forced my way literally out of Diliman to be here with you. I was just awarding 33 books published by the by the UP Press, 33 books. We have a very good harvest last year, and I hope to increase the number of publications for UP Press. And before that, we signed a memorandum of agreement, our partnership with the Philippine Energy Company called the Philippine National Oil Company. It's no longer about oil because it's no longer politically correct to be promoting more dependence on fossil fuels. But the plan is to be prepared for El Nino, which is coming, probably has arrived already. We intend to set up 600,000 solar panels all over the UP, starting here in the campuses of UP, in partnership with the PNOC. So we hope to be able to power our way forward as we try to achieve our main mission, which is threefold: basically teaching, research, and public service. I say public service because I don't want to use the extension. It sounded rather not a main part, but a mere extension. So I use the word public service. So a pleasant afternoon to everyone. I am happy and honored to be here with the pillars of the country's research and development in the sciences community, the R&D community. R&D thrives on the spirit of dynamism, and it is the spirit that has kept you at the forefront of the public health sector for the past 26 years. Health for All has been the trust of the UP National Institutes of Health, as you know very well, since its creation in January 26, 1996, by the UP Board of Regents. You collect and collate knowledge in order to answer the health needs of our fellow Filipinos. You have shown how different types of knowledge and skills are malleable tools in our quest to improve our population's health and well-being. I congratulate our scientists and researchers from the Department of Ophthalmology in particular, as well as those from the Institutes of Biomedical Research, Biotechnology, and Molecular Biology for being the foundation of the UP NIH. It is through your concerted effort that UP's motto of honor and excellence in the service of the nation is exemplified. You see, for the past 100 years since our university was founded, starting with you in 1906, the College of Medicine, therefore UP Manila, we have always banded about honor and excellence, but we have forgotten the raison d'etre of our existence, which is to serve the Filipinos. So I have asked that honor and excellence for henceforth should include service in all our t-shirts. You have played your part well in creating a healthy nation as we aim for national development. I cannot find any instance more significant than during the last pandemic. And there will be some more to come, we can be assured. But those were dark days. And in those times, you were able to develop low-cost technology to detect SARS-CoV. This paved the way, as you all very well know, to the immediate action on the part of our healthcare workers. Countless lives were saved, restoring hope that rippled through a brighter view of what was to come. The RX box, for example, was also developed during the time and it opened the door for telemedicine and telemetry. I know. I was there. I volunteered to be part of the skeletal force despite sitting at the Regent, which is basically a policy-making body. And I was here during those times. Those were very dark times indeed, but we managed to survive. As a matter of fact, I have asked that some form of monument be established here. Simple. Maybe marble monument for the names of those heroes that truly serve the nation and paying the highest price. Let us not forget health-related policies which sprang from research outputs of the UP NIH. Let me mention the Newborn Screening Act, the Universal Newborn Hearing Act, and the Rare Disease Act, and the National Vision Screening Act. The last one I helped push the Malacanang for the signature of the then President, PRRD. It is satisfying to know that these health policies, which have found its way into the layman's lexicon, began with you. The UP NIH is a dynamic example of how we can give life to two of our this current administration's flagship programs under our strategic plan for the next 5 years. Your continuous aim to pursue knowledge falls under our pursuit of academic excellence in teaching, research, innovation, and creative work. Under this program, the university aims to fully support collaborative, multidisciplinary research for maximum local and global impact. I hate to use the word global. I don't think it's a very good contribution to the English language, but local, yes. And so let me assure you that I and my administration are behind you in all your endeavors. Another flagship program of the current administration is innovative collaboration to research groups, creatives through partnerships, hubs, and S&T parks. This program aims to strengthen UP's collaboration with the academe industry, and communities through the creation of an innovation framework for partnership building. Foremost under the priority areas is health. With its outstanding track record, the UP-NIH has gained its rightful place as one of the 4 core agencies of the Philippine National Health Research Systems. In this year-long anniversary celebration, the research works of UP-NIH directors and faculty will be in the spotlight. To those slated to present their papers, congratulations in advance. I know your work will pave the way for a better national health system. I know, I really know. I also commend, allow me, the national scientist on national sciences talk between Dr. Carmencita D. Padilla, our newest minted national scientist, and Dr. Ernesto O. Domingo. May we have more venues for the open exchange of scientific ideas, especially from our renowned experts and scientists. Your 26th anniversary theme, Justice, Equity, Diversity, and Inclusion, or JEDI, in population health research, ensuring better health services, health practices, interventions, policies, and outcomes for all, is literally breathtaking in its scope. You have covered all aspects, I think. What I find remarkable is the emphasis on population health research in your attempt to zero in on particular health-related issues. You certainly do not want to leave any stone unturned under the guidance of the Jedi spirit. Hailing the spirit of inclusivity, you are living up to the real essence of being Iskora Lambayan. So may the force be with you. Thank you very much. But let me tell you something. I told you this before, especially the last graduation class. I went to Tawi-Tawi last year to become the speaker for the commencement exercises of Mindanao State University School of Technology and Oceanography. And I went to Simanol. I wanted to go as far as Sibuto and Sitangkay, which is practically a stone's throw away to Malaysia and Sabah. And I noticed so many things. I noticed that they have one of the most expensive power in the world, electricity rates, power rates in the world. They don't have the water. When I took a bath, the soap will not bubble. It's hard water. They throw their fish after lunch because power rates are so high, they have no refrigeration. So all those lobsters and really nice seafood would go to waste. I noticed they have schools there made of wrapped bricks and corrugated iron sheets, maybe about 7 classrooms. One of them was the principal's office. Those are their high schools. I cannot imagine a bright future for anyone who wants to go through those places. And I think I already told you before that I am a member of the Luma tribe. I am a member of the Manobo tribe of Agusan Valley. And my Luma name is Datu Mancalagan. Yes, I was named Datu more than 10 years ago. And let me tell you why I feel so strongly about the work that you're doing. Because in that Simonol Island, there is not a single doctor. If anyone has any serious medical ailment or emergency, even the hospital in the capital of the province in Bungao would not be sufficient. So they have to take a speedboat, if they're lucky to find one, to make a 24-hour trek to Zamboanga, if they're lucky, for treatment. If an emergency is anything serious, there is just no way. And I was thinking that I was talking to the only UP graduate in that island. His name is Haji Faisal Malande. Sabi niya sa akin, my name is Haji Faisal Malande. Sir, Malande. He had to repeat it so that I don't make a mistake. I was thinking, sir, pwede bang yung Return Service Act ng College of Medicine, yung makadaan-daan ba lang dito paminsan-minsan? So I have something better, telehealth, if we can train one of their public health workers there. I don't know how to do it, but I know you would. And the reason I'm saying this is that having grown up in Mindanao, I'm telling you, in the history of that island, it has never known peace. But today, they are experiencing something rare, relative peace. I know there was a bombing in MSU just a few months ago, but it disrupted otherwise what looks like a promising, durable peace. And my prayer is that it will hold. MILF and the MNLF, I had the opportunity to be engaged in the peace negotiations in 1996 as a young lawyer, my first job at the office of the president and the President Ramos. They are converting themselves from warriors into government bureaucrats, and we are helping them. College of Law, my college is helping them come out with the Organic Act, they're implementing rules and guidelines. I know you're there too. The College of Agriculture is also there. And as a matter of fact, I'm setting up a BARM Institute in UP Mindanao to help them with policy. My worry is this: if the peace in Mindanao will not hold, if the peace that they are experiencing now will not bring palpable benefits to this area, the many faces of the young people I saw, full of hope, so clean, so innocent. They desire to be part of the opportunities that a few in the country are enjoying today. But if there is no peace and we cannot produce tangible results within the next 3 to 5 years, these very young people today, yearning in their heart for peace, will once again listen to the siren songs of violent extremism. And if there is no peace in Mindanao, there will be no peace in this country, because they will remind us time and again, like a nightmare that refuses to go away, that we have in the University of the Philippines some very, very hard work ahead. I literally cannot sleep at night just thinking of those faces. I was already asking our engineering department to look for mini baseload, small baseload power programs for island communities. I have asked our hydrological engineers to just imagine mini bulk water projects, again for island communities in one province spread all over 11 islands near Sabah, near Cebu Strait. And today, I'm going to ask the NIH and UP Manila to please send a response. I will be there. I have called for the revival and rejuvenation of our beautiful program, our Pahinungod, our Paninilbihan. And I'm calling for 10,000 volunteers to go out there to address some of the most difficult things, some of the most difficult challenges that we're facing, particularly illiteracy. There is an ongoing EDCOM 2 review of our education system today. And I heard the report, and it makes for grim reading. 9 out of 10 of our grade 10 students cannot read. Oh, they can read, but they cannot understand. I have always thought that our public high schools are worst off because of lack of resources. But the surveys have shown that our best performing students in high school, including those in our elite private schools, are only equal to the worst performing high school students in Singapore, My job before coming to the university as a labor attaché, I've been assigned to many wars because my area is crisis management. I'm afraid that the next generation that will join the labor force within the next 10 years, or maybe earlier, will be the people who can or only good for manual labor. And I will go back to my old job approving contracts for overseas work where Filipinos will go to perform menial tasks for families whose governments have made a better job of taking care of their economy. It's a scary thought. And we have so many programs, a slew of programs to respond to that. But I also know that the University of the Philippines, no matter the great burden imposed upon us by history, we were created no less than to lift this nation forward. It's an Olympian burden. We were created over 100 years ago to provide leaders for this country. And we have done exactly that. 13 of the presidents of this country, of the 17 presidents of this country, came from our school. 14 of the 24 presidents of the Senate came from our school. 14 of the 27 speakers of the House came from our school. The current Senate president is from UPLB. The current Speaker of the House is my classmate, Martin Romualdez. 16 of the 28 Chief Justices of the country came from our school. Go to any government offices and there's a policymaker that comes from our school. Check on the roster of captains of industry. They came from our school. The single individual richest Filipino today came from our school. 44 of the 81 national artists, three of them I honored just a few nights ago, came from our school. 40 of the 42 national scientists came from our school. 8 of the 9 national social scientists came from our school. And yet 100 years after our foundation, we are among the most unequal country in the world. This is not flattering. Clearly, our job is not done. And if we keep on pointing to others, especially our leadership, about what ails this country, remember this. We will be pointing at ourselves. I did not come here, of course, to give you sad news. I know that even during the darkest times of COVID, we all managed to smile without pausing from the task at hand. I happen to believe in the iron that is there in the UP spirit. It is almost an innocent, boyish hopes and dreams kinds of belief in the university. Because I did grow up in a small backwater town where there's only electricity 3 days in 1 week, where the Philippine basketball games were shown on our TV 2 weeks late. And the only thing that entertained us was reading. It's a little boyish hope and dream kind of vision. But we have no choice. We have to believe in ourselves, and that we have to believe that we are not equal to our own self-conceit as the best and the brightest of this country. And we just have to exert effort after effort. And when we are done, do something more. I try to exhaust myself at the end of every day after day, to reach out. And some are complaining already at the face of my work. Some are complaining already that everything is in shambles. Don't tell them that. I believe in chaos theory. Every time they're complaining they cannot catch up, I smile myself secretly. Because sometimes it is the only way to energize a momentum that I think has to change. It's a momentum of stasis. I have stories for that, but I will not share this today about the stasis sometimes. So time and again, disruption has always proved good for organizations. But I realize, of course, that UP Manila, being UP Manila, is born in crisis and disruption, and you are natives to it. And I hope that you can inject the rest of the university with that kind of spirit. I came here to express my deep admirations for the work you have done. Truly, deep admiration for the work you have done. I may be a lawyer, but I do understand the significance of your work and some of the science that goes into it. So my only prayer today is that you will continue to unite and privately spare me a few of the pains and heartaches of running the most complicated institution in the land today by your good work, by your collaboration, by your generosity of spirit among each other. Because I am here to continue what I declared when I start my presidency, and that is to support all your programs. All your programs. Magandang hapon po sa ating lahat.
Thank you very much, President Hugh, to be with us here to celebrate the NIH anniversary. And after you're listening to your talk, it made me like think and reflect, like being as a researcher, how can I do more? How can I bring my research or how can my research benefit the communities, especially, for example, in Mindanao? And thank you for reminding us the motto of UP, which is to honor and excellence in the service of the nation. So thank you very much, President Jimenez. All right. So once again, thank you very much to our distinguished guests for coming here and celebrate with us for the NIH anniversary. And now we're going to shift the gear a little bit, and because we're now moving to our main event, because we have invited two national scientists to discuss how to have JEDI practices in population health research. So JEDI, that is justice, equity, diversity, and inclusion to ensure better health research practices, interventions, policies, and outcomes for all. And to introduce our national scientist and our moderator, may I now call Dr. Mario Festin, the chair of the scientific committee. Sir.
Thank you very much, President Jimenez, all the dignitaries on that table over there, and all of them are my friends, and all the other institute directors and faculty. I am Dr. Mario Festin, the chair of the scientific program of the NIH anniversary. I acknowledge my co-chair, Dr. Is Alejandria over there. It pays to be absent during the meeting because you get assigned this work. So that's just a warning. But I'm also the director of the youngest institute in the NIH, the Institute of Reproductive Health. Although probably I'm the oldest director around. Given that, I'm given the honor and humbled of this great, awesome task of introducing our guests and speakers for this activity. Both of them were my mentors and have worked with them in various capacities. So they are going to grace us this afternoon with their presence and why their wisdom. The first is Dr. Carmencita Padilla, who is recognized for her outstanding contributions to medicine in pediatrics, especially in the field of genetics, specifically the newborn screening for genetic disorders in the Philippines. She is known for her professionalism. Nabalitaan ko, hindi daw natutulog yan ng Chancellor. But I disagree because I know her family very well. But she has lots of contributions for research, teaching, and service in the identification and care of newborn babies with genetic disorders. She was already mentioned that these were pivotal in the crafting of the newborn screening bill and its enacting into law. A round of applause, please, for Dr. Carmencita Padilla to please come to the front. Our second national scientist received the Science Achievement Award in Medicine in 1985, awarded by National Research Council of the Philippines. I've always admired him, and he was my professor in the College of Medicine, but he is also recognized for his groundbreaking studies with the schistosomiasis species, viral hepatitis, and liver disease. His research led to pioneering a preventive solution to liver cancer via the work on hepatitis B vaccinations by newborns. His work finds applications in healthcare and immunology. Our colleagues in the Institute of Clinical Epidemiology would always remember him as our loving sponsor during the early times of our institute. I am also very happy to note that he was a recipient of the Ramon Magsaysay Award in Medicine in 2013. So let us welcome Dr. Ernesto Domingo. Please come to the front. To moderate the session, we are honored as well by one of the few women to have reached the upper echelons of the leadership in the World Health Organization in the Western Pacific regional office. She was the first director for the Non-Communicable Disease and Health through the life course from 2013 to 2017, and recently the director for program management. She is a very good friend, but she is also very active in media, and she has had senior management experience in WHO for the last 15 years. She was my colleague. We were very good friends, and she always visited when I was in Geneva working for WHO HQ. She has always been and will continue to address gender imbalance for health equity. Please welcome Dr. Susan Pineda Mercado to be our moderator this afternoon.
Okay, thank you very much, Mario. I used to be a boarder in Mario's house in Geneva. Yes, that's his apartment. Anyway, welcome everyone. I think if you have not been touched and are not burning with passion after President Jimenez's speech, I don't know what's going to take you off, right? So he has just, in a very provocative way, challenged us to do much more than what we're doing. And so I'm not going to delay this further. We're going to hear first from Dr. Domingo, who will give his reflection on the entire topic. First, let's start with that, right? Okay, sir.
cannot even operate a microphone. When I was given the topic, I thought we will be discussing Star Wars. It's Jedi. And however, I did see the reason why they put that up because they partnered the Jedi with population health research. Let me start by reading something I wrote a few years ago when I received the most outstanding UP alumnus award. And let me go through this because this will set the tone. Oh, before I do that, I forgot. I have to say a few things about the National Institute of Health. In 1988, when President Abebo was appointed president by Cory Aquino, he created a committee composed of a few people that included me, but this was headed by a Jesuit priest, Father Candelaria. I don't know where he is now, but all the other members have all been gone. Dr. Cecilao, Dr. Jose Baez, Professor Yabes, and Dr. Apriniano, Dr. Apriniano San Juan. When I became chancellor, I all appointed them my vice chancellor. They are members of the committee. But at the time, there were three major initiatives that we recommended to President Abeba. Two failed miserably, one succeeded. The first recommendation we had was we were drunk with the return of democracy. We said that governance in the university must be democratized. At that time, a friend of mine, the father of dengue, who used to teach in Hawaii, Dr. Scott Halstead, got wind of it and said to me, you be very careful. Democratic practices in the political sense is not applicable to the university because by nature, the university is elitist. After all, you select the best student. How can you be democratized that way? And so when we created the so-called Pamantasang Assemblea in UP here, immediately we saw the truth of what my friend told us. Because when we organized the Pamantasang Assemblea, which is a body composed of representatives from all sectors, to look at the proposed policies of the university, pretty soon we have a small congress. They're no longer working, they're always meeting. So we let it die. The second is we said that according to a Harvard study, when you have a hospital with 500 beds or more, you can assemble the brightest administrator, you will still have a hard time. The limit is 500 per bed hospital, which is very big. So I recommended to create 4 or 5 separate autonomous hospitals to be headed by a super director. When we did that, I was brought to court. So we went to court and we lost because the lawyer who happens to be a graduate of law, Jainal Rasul, said, after all your verbiage, it all comes down to this. No matter what you interpret the plenary power of the Board of Regents is, they cannot change the nature of PGH. Why? Because it was created by a law. And no plenary power of Board of Regents is above the law. You want to do that, you go back to Congress. Natapos. But the third succeeded. And this is, I'm very proud because this is my brainchild. I want to put together the research activities in the hospital. They're all over the place. So I proposed the Institute for Biomedical Research. That was the original proposal. On second thought, I said, I've learned from my old professor, medyo mahaba na ng konti, professor in public health, when he told me that when you have a public health problem and you have the technology to solve the problem, by all means, apply the technology. No question about that. But don't ever expect that technology application alone will solve your problem. Because, ito na, sabi niya, because there are social aspects in the solution of the problem that your biomedical approach will never be solved. So I was then convinced that medicine is a social science. So I insisted it should be called Institute for Socio-Biomedical Research. Now, after it was established, we began the activity. 1 year later, when my predecessor came after me, she proposed the law to make it NIH. So that was the former ISBMR. So the second is, in 2008, the late Dr. Romaldes and myself were asked to deliver centennial lecture because it's the centennial year of the university. And Dr. Romaldes dwelled on a thorough review of the state of health of the nation. And at the same time, there was a committee called the Lancet Commission, created by the Lancet publication, to look at the most important health problems in the world. And we have an early conclusion by 2 years to the Lancet formulation, because Quasi Romaldes and I had said the real problem in our country is not about, in health is not about disease, it is about inequity. And 2 years later, the Lancet Commission said the number one health problem in the world is not a disease, it is inequity within nation and among nations. And so after our lecture, Kwasi and I look at each other, so what? What do we do now? We identify the problem. What will we do? So we embark on the universal healthcare advocacy. 2008, after 11 years, we succeeded in passing the law in Congress. And we have now universal healthcare being implemented. So that's a very, let me now conclude this very long introduction by saying, by reading from what I wrote some time ago. Yeah. The inevitable question that arises out of this story, I gave a story, is addressed to us researchers, especially those of us in the biomedical field. Did we embark on our research career with the ultimate aim of finding something that will have practical application? Or do most of us start simply, that is research, to find out the answer to a question that fascinates us? That is the real scientist. And that was partly answered by a non-scientist. The biographer Conrad Keating hazards an answer to this question when he said, perhaps it is the excitement and the fun of science, that it was all right to be wrong, and that what was important was to enjoy the thrill of the experiment. In return, and with a little luck, the work would in some small way be relevant to the people in need of help. That is exactly how I feel as a researcher. I am interested in a biomedical question, so I pursue it, little realizing that at the end of that, there will be a big question relevant to the problem of inequity. And so I concluded this remark by citing a story in England when the relationship between electricity and magnetism was established by a scientist. And when it was presented to the Prime Minister, the Prime Minister said, and so what do you think? What importance do you think you have established linking magnetism with electricity? And the scientist said, Your Honor, there will be a time when you can even tax the electricity that is produced by my gadget. And that is true. So the thing is, science per se to a scientist starts with a very interesting science question, but somewhere along the way, he found out that what he discovered by way of science must be used to ameliorate very important problem, in this case, health of the community. And that is when the scientist is transformed from a scientist to an advocate. Thank you.
Okay, thank you very much, Dr. Domingo. Okay, Menchit.
Let me translate that to the local situation, as Dr. Domingo talked about examples from overseas. And I agree that as a young researcher decades ago, I was fascinated by questions that were relevant to my field of genetics. So I think when I look at the crowd and I see researchers of all ages, it really starts with a personal interest or a problem of the country that you'd like to participate in problem solving. But really, as a researcher, you start the basics and in the clinics and in the lab. And once you have your data, it's a question of where do you want to bring it? Before the forum, we were discussing, moving forward this program of mine, the newborn screening. I said that it was a very simple question 27 years ago. And we just wanted to create the data to give the government. But what was clear within the group, because together with Dr. Domingo, the wife of Dr. National Science Domingo, and I, we had the vision for the country. But what started with was just a project. And I think, what's important now for the researchers to understand that research questions are important. The process after the data collection is equally important. And you have to understand that even as a scientist, you cannot stop there. So on my end, I moved into the policy area because I wanted to reach the destination of the future. So the issue of the JEDI, as I was reflecting on JEDI in relation to, let's say, the program that I have, now looking back, I think we fulfilled it. But honestly, when I was doing the research, I did not ask myself, was it just? Was it equitable? Was it inclusive? Not at that point, because we were just trying to answer a question. But now, looking back 27 years after that project, wherein we are now covering 94.6% of the newborns as of December 2023 in 7,200 hospitals, including Tawi-Tawi and Basilan and the GIDAS. I can say that what we discussed 27 years ago truly ended up to be just. It was equitable because rich or poor, born in the mountain, in the island, in the GIDA, and of course being inclusive, nobody spared. I was surprised that during COVID, the numbers did not go down. So I think, my message really here is that continue doing your ideas. I mean, that's important. This may come afterwards. But National Science Domingo gave examples. It has happened. And I think as a group, we can make it happen if these ideas eventually move into programs.
Okay, thank you very much. Let's give a hand to Menchit. All right, now I'm going to pick up on what you both raised. When I saw this, I said, okay, this is a research group, and are we thinking about justice, equity, diversity, inclusion in our methods? Are we looking for it in our results? Or are we looking for it in the application of the research into policy or programs? So I'm going to ask both of you that question, because when I think about where you want to, because we say in population health research, but we know that research has a long process and has multiple dimensions. Okay, so.
Well, I will just continue the narration and to answer your question. When I got interested in liver disease, it's about cancer. And the reason that brought us to do research is, if you think about it, it should not have done that. The reason was this. My colleague in the Department of Surgery said to me, Hoy, you better do something about liver cancer. I said, why? Why? Because your 150 bed unit in the hospital is admitting no less than 80 cases of liver cancer a year. And none of them go out. They're all dying. So you better do something. It's not even my own idea. It was a surgeon telling me, do something about it because nobody's care about cancer, which is the #1 killer. So when I thought about it, to make the story short, organize a liver study group. We did first the clinical study, then we came to the what is causing it. And we found in our country that according to our study, the #1 cause is hepatitis B. And it is the type that is transmitted by mother to child, not the type of infection that you get as an adult. That's not too dangerous. The one you get the moment of birth is the most dangerous. And so when we surveyed, he said, then at the time there are concurrent developments with plus the emergence of a vaccine that is very good in protecting it. So we look at it. We went through an exercise on what to do and how to prevent the disease, putting everything into consideration. Because of the vaccine, our health organization, whether we can deliver it, how do we find mothers to vaccinate or just vaccinate every children born of every mother without screening the mother. That's the magnitude of the question that we have. Finally, we come to the conclusion that based on this study that the one that we should protect are those babies born of mothers who are carriers because they are almost all carriers. The problem is 80% of delivery occur in the home. And even in the hospital, testing for the mother who are infectious is very difficult. So what we did is we did ministry, and the vaccine came out very, very expensive, $50 per vaccine. So what we did was look at our friends. #1 is Japan, Red Cross Society, and the Kitasato laboratory which developed the first effective vaccine in Japan. And then we look at our friend in South Korea, happen to know the head of the Chail Samsung group that develops the vaccine in Korea within 2 years. And so to make the long story short, we explored all avenues in how we can get the vaccine so cheap that the Department of Health can finance it. And so we went to the Department of Health and brought executives of this company in Korea. I said, tell us what you want. We will build a whole facility to process your own vaccine, except that you will buy the vaccine exclusively from Korea. So after everything is done, we decided we will get the Korean vaccine exclusively for the Department of Health. There is no marking as to its origin. It's only to the Department of Health. And in exchange for that, they will give it a really giveaway value, about 25 pesos per vaccine. I even went to the Secretary of Finance and said, Mr. Secretary, according to the Koreans, if you do not tax the vaccine, it will be much lower than other vaccine, and our government can afford it. Secretary Jaime said, by all means, I will remove the tax. And so the vaccine, Chusi, was used by the Department of Health for peanuts. But the problem is this. Look at the problem. But it's not getting ahead as we want to. And the reason is asked Secretary Alran Bengson, why is it not being given full blown? Because the EPI, your vaccine is last. And the EPI budget in Congress hasn't been increased despite the fact that we added one more immunogen. And therefore, your vaccine suffers. We first give polio, pertussis, etc. If there is a leftover, we spend it in the vaccine. So what's the next move? You go back to Congress and ask for additional budget. And we went to Congress to do that. It takes many years to finally, so that Congress said, we are going to allocate a specific budget for your vaccine, which we have now. Those takes almost 20 years of work. If you are a scientist, that's my job. My job is to explain why the virus is causing the cancer. Maybe if I am able to explain that, my job is done. I can retire. But you see, it's very hard. It's very hard when you're confronted with the situation that you know the solution. If you stop short of attempting to give the solution, I don't think you can live with that. That's what happened to us. We just cannot live with ourselves knowing what to do and not having done anything about it.
Thank you. I mentioned before you take
Okay, so
before you answer that. So I think what Sir is saying is, and you also talked about it, mentioned, Nana, you start out with something that's kind of pure science. But as you progress, you ask yourself, what's the use? What's the point in doing this? And therefore, it is a continuous problem solving. And that's where you say this an advocate. And I know Menchit's going to talk about that because it's like from your lab, from you, what you know about the basic science that you're dealing with, you have to now shift into a political arena and fight for what you're doing. So, Menchit, go ahead.
Medyo masaswerte naman ako kay Sir. Okay, because by the time we introduced newborn screening in the country, we were 30 years behind. Okay, so that's the first. We had a core group, very small core group, and then we expanded our core group to 24 hospitals. But we had to convince them, it's just like a room like this one, convincing the people that join us in coming up with data. So no data, no policy. That's the first thing that I learned from the Department of Health. Soon after I came back from training, I went to the Department of Health. It was Dr. Alex De Leon. I went to him kasi faculty. I wanted to introduce my idea. And he just told me, Menchit, no data, no policy. And there was no data in the country. So that's the first lesson. But the thing is, you see, when we had the data and gave it to the Department of Health, we had the same message. Menchit, ganda ng data. Congratulations, but it ended there. So I think, we have the same story wherein we just have to continue until government is ready to take it in. So that's first. But in my case, I went back to school. I went back to public health and did the policy, the MN policy, because I wanted to write the law. So medyo masaswerte ako kay Sir, because I realized that legislation is a strategy. I'm not saying it's the only answer. So I wrote the law in 2003, got passed in 2004. But I'm just warning you, legislation is only part of the solution. What is important is how to implement it on the ground. So I think the second message is if you really want to push a program that will go national, you have to start creating your networks across the country. And that is another story which I will not discuss today, but it's really engaging all sectors, all groups who can be part of the game. So when you were asking, where does this come in now? To be inclusive, to make sure it's equitable, you actually engage all the sectors, nurses, midwives, teachers, youth, and so on, to make it a reality. If you look at the graph, and I have a graph for this to show always the audience that even if I had the law, even if I had PhilHealth covering it, it really took more than 15 years to get to the point that we were happy with the coverage. But for me, the biggest lesson that I got during COVID, which I want to share with you, is that I had the biggest fear that the coverage of newborn screening will drop during the COVID pandemic because we were collecting samples through the courier service. And since all the borders closed, I was expecting that the numbers will drop to 50% or 40%. But lo and behold, we were close to 90%. So the message now is that if you bring home your message to the ground, and they're convinced that your passion is not going to be wasted just because of a pandemic, and that they can do their part. What did they do? They used farmland, police, military, and the Navy to bring the samples from border to border. So at the end of the day, my role was just to start it, to engage a whole set of networks, and if you're able to convince them, it will be sustained. That's why we always say that the program is a test of resilience of the country. We're one of the few countries in the maybe the only country in the LMICs been able to sustain this level of engagement. So where is it coming? It's across the method, the process, and if you're a researcher, and if you cannot do it, then you get somebody else to do the policy part. But I think in the case of national scientist Domingo and myself, we decided that from the bench, we were going to go all the way until we get the government to convince us.
Okay, let's unpack that a little bit because I think when I'm hearing both Sir and Menchit talk about the scientist as advocate, I see certain approaches that you're using. Okay, so one of them is relationships and networks. So you've talked about secretaries of health, you've talked about your colleagues, you're talking about firemen and so on. So you've got these researchers here who are being trained in the rigors of research. But what they need to prepare for is also the rigors of being in a world where you need to convince people who don't really understand what you're doing. So how do you become, from scientist, an effective advocate?
Never aspired to be an advocate because my forte is science, not going out. But again, you know, when you're confronted with problems like this, and the truth is, who's going to do it? You know very well the problem, and you have something in mind by way of solution. Can you endorse it to somebody to do? That's very hard to do. You got to do it yourself because first of all, you're the one who understands the problem. Number two, you're the one interested in solving it. And you cannot find anybody else with the combination of these two combinations. So, but it's not mandatory that you demand that out of all the scientists working. No, not at all. Because even people working in pure science, without their intending to, may create a situation as a consequence of the finding that push or give the wherewithal to do a advocacy type work to solve the problem. Just one very little example, this is personal of mine. When I went abroad to study and do research, my interest is purely science. So the questions are around something like this. When I saw the man I will work with, he's an expert in tropical medicine. He told me, "Oh, I have read your work. I think it's one of the one you did with Suli, I don't even know the name. The one on hemodynamic changes in system. I think that's one of the best study and clinical study in this disease." And then he said to me after that, "By the way, what kind of textbook do you use in pathology? I mean, in tropical disease?" I said, "Craig and Foss." That's for many years. You guys also, Craig and Foss. And then he asked me the question, "What did Craig and Foss say about the cystosome granuloma?" I know that very well. Well, that it is a foreign body type granuloma. And he told me, "Do you believe that?" For the first time, the issue, do I believe what I read, struck me, you know? And I thought, yeah, come to think about it. Why will I believe that? I said, because why will you call a foreign body granuloma when the inciting agent is a living thing? It's not a splitter of wood under your skin. For the first time, a question set me to thinking, all this year pala, the question is right in front of me and I'm not trying to answer it. So I work on cystosome granuloma. Finally, when I left the study, I sent somebody there, Dr. Reno Beda, continue the research. Do you know the product of that study? The benefits of a vaccine for cysto, which we're not using in humans, we're using in animals because that is the greater reservoir of infection. I cannot anticipate that the world will eventually lead to the development of vaccine. My interest is just to prove great and false wrong.
Okay, mention.
Okay. I never planned what I'm doing right now. Okay, so that's one. If you want to just to do science, this is where we will need help from administration. We really need science communication experts because some may not be savvy in talking to media. Because I had to do that. I took advantage of every invitation that was free in television, in radio. I never refused anything. But at one point when I couldn't do it alone, I actually prepared a slide deck for a team of people who went around the country. Okay, so in other words, I prepared the deck with everything that should be written and then with all my anecdotes so that I could multiply myself 100 times because there was no way I could go around the country. I can't be out because I'm teaching and I'm running a lab. And then, I've got NIH, I've got NSRC. So it's really releasing your information, your knowledge, and not being threatened by sharing it with somebody else. So if you're willing to do that, then you're not alone. But once you decide that you're the only one who can do it and say it, then that's a problem. So science communication experts will be very important because they can be the medium to the public. Isa pa, iba ang message sa I can give you a 5-minute talk with the mayor, with the congressman, with the senator, anybody else. But I can also give you a lecture for students and then for teachers or faculty. So in other words, it's just the audience. So if you know your subject matter, regardless of who your audience is, just as Dr. Domingo was saying, you can deliver it without having to memorize anything. So science communication is going to be the medium. One last kasi nga nandiyan na yung media ngayon, yung TV,
Go ahead.
You have to adapt to the times, no? I mean, 27 years ago, we just used print. Brochures. We used comics for more than 10 years. Comics. It worked. We distributed it. But the other thing is that as we became digital from website to Twitter, and the latest is that we have a webinar series just for newborn speaking, TVUP. So
Let's wait for them to fix that.
So in other words, you thought down. You cannot say that I go print because that's what I know best. You adapt with the times. So right now, we're now into webinar series and so on. So even knowledge is the same, but the process may change. And then you just use the medium that is available and appropriate at this time.
Okay. You have in front of you two national scientists, okay? And they say that greatness inspires greatness. So take an opportunity later to talk to them. But so I'll do the boy abunda question. Sir, who was it? Can you name somebody who inspired you to be this kind of a scientist that thinks about the social utility of your work?
There are so many of them. It's a stream of people beginning with professors. The areas experience I have that points to research is, as you know, our former dean here and president of the university, Antonio Sison, when he told me two things. Dr. Domingo, if we throw all our medicine into the ocean, bad for the fish, good for men. I contemplated on that. simply means there are so many bad science. And second is, and this is the most important, you come to our house, to my house, because I'm going to tell you something. So I went to his house. He said, Dr. Domingo, a doctor who knows only medicine does not know medicine. I suggest that while you read textbook medicine, you start reading on philosophy, social science. And he recommended the first book to me. And he kept on showing that. Then the next thing he said is, do you know, Dr. Domingo, why we commit bad mistakes? No, sir. It's not because we're stupid. It's because we make shortcuts. All those things, it started me on this. And then the next one is another day. He said, when I was being appointed head of the department, hey, come here, I teach you something. You are now accepting a position, administrative position, and you will be making decisions that will affect other people. I suggest you follow this formula. You ask the question number one, is the decision I'm going to make pleasing to God? That's number one. Number two, will it make my country better? Number three, will it strengthen my institution? Number four, will it ennoble my profession? Finally, last two, will it benefit my family? And the last one, it will benefit myself. That is the parameter you will do. God, country, institution, your profession, family, and you are last. And so there are many others, like I told you, you have the technology, apply it, but there are social aspects that you must do. And that is basically the other one is very important. As a researcher, honesty in handling funds is very, very, very important. So China Medical Board of New York came over and the first is I had an re-entry grant from Rockefeller. After the end of my work, I think there is a surplus of about 26,000 pesos. So I brought the foundation and said, I'm returning 26,000 pesos from the grant that you have given me because it was not spent. It came a very, very, very violent reply. Don't again. Why, sir? You're going to make.
Wait, sir, sandali lang. Can we have assistance first on the sound system, I think?
Very complicated in our
Sir, sandali. May echo kayo. May echo din ako. Yeah, we can pass the mic. Please don't press.
Mahina.
Mic test. 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 It's just that this mic won't reach sir.
So, sir, can you try? Yeah. Okay.
Yeah.
It's about handling money given to you for research. So I returned that. They were mad at me. Don't ever return that because that has been liquidated with the IRS. So I said, what do I do with the money? You can keep it if you want. So course, I will not give it. They donated it to the department. So this is the payback. Later on, the president of China Medical Board came by. So they are part of the Rockefeller Foundation. So then I approached the China Medical Board, Professor only, I need some fund to start a fellowship program in medicine in the country, so we don't have to send people to be specialists in the country. Immediately, he gave the fund. And he was, as part of that, he said, when you report your expenses, I want only a one-page report. Don't ever attach receipt. Why, sir? Because if I trust you enough to give you money, I trust you enough that you will spend it correctly. So the return is very big, a simple honesty pays a big deal. And we have no harm, as long as the money is available and we request it, they give it. I think that is very important in research, honesty in handing the money.
I'll put a twist into that question because I think my situation was different. Returning, I had to set up many things. I had to be a researcher. I had to be a faculty member. Nag-iisa lang ako nun sa genetics eh. I had a 1-year-old and I had to do the clinics in PGH. So the bottom line is who actually inspired me that I can do these things all together. Okay, so as a young geneticist, kasi pagkagitin ko pangalan ni Sir.
Stop ko na mention.
Hello, is it better? Okay, I'm going to give a twist to the answer, okay? Because my situation was who inspired me to continue being a clinician, a scientist, an administrator, and then a family person. So pag tinignan nyo, iba yun. But at this point, I really want to mention like supportive administration who allowed me to continue my work in the lab, considering when I came there was nothing. Well, of course, the chancellor then, Dr. Domingo, gave me one microscope, and the dean of the College of Medicine gave me a refrigerator. I mean, that's really how I started. And then my supervisor overseas gave me 14 boxes of old equipment. So if not for that support, of course, now we know how big genetics is in the country, but then if not for that support, so they inspired me and told me that continue your work. So the bottom line is now, when I got into the administration this time of the next chancellors, Chancellor Perla Santos Ocampo, at labo-labo rin ako because they made me director of Ugnayan ng Pahinungod, which I had to set up from the ground. I had to be a geneticist and so on. And when I finished my term, and this is something I want to share with you, I wanted to do a PhD. Sabi ko, it's my turn because during the term of President Emil Q. Javier and Chancellor Santos Ocampo, they pushed for scholarships for PhD. Sabi ko, ako naman. This is what they told me. Menchit, you cannot leave. Because who will do what you are doing right now? You have to let the others go ahead and just stay here in the country. So up to now, every time I have an event with President Javier, I blame him for that. But the point is, I had the mission. So Chancellor Perla Santos Ocampo and President Javier gave me this message that we all have a role in this country, in this world. My role at that time was to set up the genetic services in the country. If I left for my program, you don't have a newborn screening program right now. If I continued my original plan to become a neonatologist, we don't have the program. So maybe, for the young ones who seem to, you don't know where you are, I think the answer will come. We all have missions.
And now at retirement, I have a different mission again for the president. So he has given me a couple of assignments. So I believe that each one of us will just have to sit still and feel what you think will be good for the country. I like, I've heard this story of National Science Domingo about it's so easy to decide for God, for country. Ang dali-dali eh. When you have that in your priority list and yourself is the last, it's so easy to make a decision. God first, country, a profession, family, and then self. So do that exercise when you go home and you will not have a problem making a decision on your next step.
Okay, so some very powerful words of inspiration from both of our scientists. I'm going to shift our discussion just a wee bit because when I read through the cue cards and when I look at the title, my field is public health. And so when we talk about population health research, that means working with communities. And so I'm going to ask this question again to our scientists, maybe in reverse order, mentioned first and then, sir. When we speak about JEDI, okay, equity, diversity, inclusion, I think some of this is referring to the ethics of our research methodology. There was once upon a time, you survey the community and you disappear into the moonlight, right? But nowadays, we're more concerned about the community as co-creators of your research findings. You engage the community, you work with them, you come back and tell them what you studied, and so on and so forth. So, on one hand, there's clinical research where you can do it in a laboratory. But then on the other hand, there is research about understanding what a community needs or the application of your research and what our responsibility is to the community who serve as subjects to our research. I'm seeing people kind of nod. Okay, so I think this is a question that has been asked of you. So, Menchit, you want to comment on that?
Well, there are many kinds of research. So let's say the ethics of using the community as your subject matter. Let's take IPs, which is a very difficult topic. So doing researches in the indigenous population will really have to consider the way you return the data sets to the population. So it has to be part of your planning. It cannot be one-sided. I think we have enough measures now within NIH and in the research community to make sure that we do that. So Eva and I had to go to the community to do the genetic studies on indigenous populations and from making them understand the value of the test and making them understand that it may not have a direct value to you, and then going back to them to tell them that this is the result that came out without putting a stigma into them has to be part of the researcher. I'd like to believe that NIH now has enough precautions to protect the researcher and the community.
Yeah, this is to me one of the most important things that I feel very strongly about ethics and the modality or practice of research. Let me just begin by saying that no scientific advance we are all very happy. We are very concerned about this now because this is being used for all kinds of shenanigans. And there is no ethics that governs it. So you have to balance it as a scientist. For example, I always say, supposing Jenner did not vaccinate with cowpox his maid, do you think we will make great advance in preparing vaccine, especially for virus? Of course not. That opened the whole field. But is that ethical? Will you get a cowpox and give it to somebody who is under your control? It is unethical, of course. But you must realize that ethics always comes behind. When Einstein was looking for the relationship between matter and energy, did he have in mind killing 100,000 people with one blast of one bomb? Of course not. He was just investigating a phenomenon. So to apply ethics blindly in the pursuit of science is wrong, and that's happening now. Why will you ask me to execute so many things when I'm going to interview somebody and just a few harmless questions? It really pissed me off. For example, when Dr. Sulit and I did the hepatosplenic hemodynamic study, one of our problems is there is no way of measuring the pressure in the splenic area. Wala pa kayong mga transducer eh. So what we need is to puncture the spleen so that we can connect it to a tube that will measure pressure. We did that knowing there is, in fact, we improvised, we did our own cannula. But later on, when I presented the subject in a lecture, I was questioned very seriously by an ethicist. Why did you do that? That's unethical. Puncturing something with a homemade instrument. I said, if we didn't do that, we would not have understood why people with the disease, normal appearing river, but vomiting lots of blood. Now we understand why. We know what to do. It's because of that study. I'm very concerned also with ethics, but at that particular time, what ethics will govern me? There's nothing to refer to. And science is replete with that. And that's going to happen over and over. So, yeah. And I hope, really, among scientists, that this is something you guard against, because ethicists has a tendency to overdo it. Eh. If you wala na magagawa, you cannot do it in the research. Really, oh.
Okay. I think at this point we can ask if there are some questions from the audience. Do you have any questions for our scientists? Yeah, come on. Go ahead. Yeah?
Some questions from the Zoom po, ma'am.
Okay, let's
Yeah.
go.
Okay. All right. So one question is that how can experiential learning and community engagement connect students or researchers to real world research projects addressing justice, equity, diversity, population health?
See, the role of senior researchers now is really to bring in students so that they get to experience how it is to be in the field. Community research is really very different from the bench, from the protocol making up to the defense and so on. So if you want to bring them along, maybe what NIH and the colleges can do is to come up with a system so that we bring in students in some of our researchers. And I'm talking at the younger age, because I think to be doing this when you're almost graduating really defeats the purpose of getting more of them to get into the field of research. They have to come in as partners or observers at the very beginning.
All right. Another question is, what is the role of mentorship and positive role models in inspiring young researchers to pursue population health research with a focus on justice, equity, diversity, and inclusion?
Well, I think all of us, even bench, it owes a lot to mentoring. No? The example we gave earlier, it's all about one-to-one with a personality, an elder doctor or elder scientist, and things like that. So, yes, mentoring is indispensable in science, very indispensable. It's really one-on-one on science. I have so many experience on this that just to give you an example how mentors do wonder to you, no? When you're doing by citing specific examples. When I was doing some experiment on schistosomiasis, we have to prepare purified eggs, and we get the eggs from the liver of infected mice. And so when I did I harvest the liver, put them on a blender, and then a series of sieve, I cannot get any material. I was wondering, why is it that the literature say do this? I followed it. I cannot get the result that they're getting. So I approached my boss, the one who mentoring me. Oh, I cannot do this. What will I do? He said, do you know what? You call the original, the author, because he's also my friend. He lives in Bahia, Brazil. You go get the telephone, get to him now. The name is Francis von Lichtenberg, German immigrant. So, Dr. Lichtenberg, I'm following your paper, but I cannot harvest egg. Sabi, no, I did not put everything there because of limitation of space. You are supposed to rot the liver for 2 days. Don't do it on fresh liver. Ergo, the same guy. We were going to inject mice weighing 35 grams. And the only way you can inject to the blood vessel is to the tail vein. The mouse has a very big vein on the tail. So simple. So I got the mouse, immobilize it through some mechanism, got the tail, but there is no vein. So collagen process von Lichtenberg, oh my God, he said, you get warm gauze, you dip your gauze in hot water and wipe the tail, and that vein will come out, and sure enough, it comes out. So, mentoring, I couldn't have gotten that on the literature that I'm reading. Got from the horse mouth. But that is true in science. You are always mentored by the sciences. And also in very big ways. In very big ways. For example, my original interest in gastroenterology is motility, how the intestine moves. So when I arrived to the training place, I said, what is your research interest? What do you want to do? I want to do intestinal motility. Oh, very good. My boss said, very good. You come to me to the basement. Why, sir? Yes, come to me to the basement. We went to the basement. Boy, the basement is full of gadgets. Do you know that those gadgets? He said, no, sir. Those are the ones we use for motility. There are pressure gadgets. Let me ask you one question. If you return to the Philippines, can the University of the Philippines or your government buy you this? I said, obviously not, sir. There's no money in research in the Philippines, especially buying gadgets. So he said, better take it over. Maybe you can do some research that is easily funded by your government. And that's why I went back to Sisto, because we have a legitimate interest in Sisto. That is the kind of mentoring that you need to develop a guy. Last, because it's very funny. So I mentored the guy, Dr. Rene Olveda, became the director. He continued the research I left in Cleveland. When he was finished in Cleveland, he worked under a friend of mine, because we were of the same age. We worked together. Name is Professor Abdel Mahmoud, became chairman of the Department of Medicine in Cleveland. So he worked with him. At the end of his fellowship, he said, Dr. Mahmoud, I want to know how I fared with you. Give me a grade on my performance. Mahmoud said, well, on a scale of 10, you're very, very close to 10. Sabi niya. Therefore, I was very happy. But Dr. Mahmoud did not stop there. You're very good, close to 10. But don't compare yourself to Dr. Domingo because he's 20. Of course, it was all a joke. But that is the kind of mentoring that you get from them. It's a lot of encouragement, little things revealed to you that you would not really know if you don't have a good mentor. Who else can give you those tips on how to do things. Very simple, but you got to know how to do it. And it is the mentor that really inspire you to do all of these things, both in a positive and in a negative way. The one I get from the other boss is negative. Can you do this at home? Can you buy all of this? That's very good advice. You have to be realistic when you go back to your country, which was then third world, no longer now second world. So you have to contend with what you can afford by way of research.
Meron akong kwento dyan. So kay sir, sinabihan siya ng mentor niya na you can't afford it. So in my case, when I was in training, I knew that UP could not afford it. But I had to set up a lab back home. When I found out that they were going to change all of their equipment, ito naman sir ang sinabi ko, please do not throw them. You send them all to the Philippines. And that's how I started my first lab. They sent me 14 boxes of equipment, and I just did my inventory because I retired. I wanted to make sure that, I'm cleared from the university, and some are still working. So mentors can come in many ways. Mentors can be local, mentors can be international. It can be financial, it can be ideas. Maybe this story is also similar to your story about, reaching out to an author. So, when I started my practice, I was the only geneticist, and I had lots and lots of patients with maple syrup urine disease. It is a metabolic disorder. So, paki-explain na lang kay President. But, but this one, I had a very complicated case, and I actually followed to the book everything that was discussed in the chapter. It was a thick chapter just on maple syrup urine disease, and my patient was still sick. So when I saw this author in a conference, I said, I had to run after her. And I said, I did everything to the letter in the book. And my patient is still sick. And then finally, when we had this conversation, this is the nice thing that she said. You know what? You have seen more patients than me. I think next time you should write the chapter. So in other words, everything that's in the book is dependent on the experience of the person, or a collection of their experiences. So my message to us is to collect our experience